as a man gets older, his prostate sometimes gets bigger, and how we experience the enlarged prostate symptoms varies depending on individual. Now, Terry went through a health issue which led to his recognition of having something going on with his prostate and urinary difficulties. Terry's going to share his journey regarding his prostate issue. So thank you so much for sharing your story.
Well, I had open heart surgery, and the anesthesiology led to my prostate basically swelling up even more and prevented me from urinating. Before the operation, it was pretty bad. Occasionally, you know, trying to go multiple times, not being able to empty my bladder. It was really miserable. So
So how were you treated when you were having urinary difficulties before your heart surgery?
I didn't even get any treatment. I didn't know I really needed it, I guess.
Suffered in silence.
That's it. Yeah, you don't really, it doesn't register because it's a slow process over years. And then you realize that there's an issue, especially when you can't go at all. Then you have to do something.
And what you say is so true. A lot of my patients will come in because of something like what happened to you, not being able to pee all of a sudden. But it really isn't all of a sudden. It's been going on for several years, if not decades.
Yeah.
And what I can't figure out is why guys don't come in to get it evaluated until something
Yeah.
bad happens.
I asked myself that question too. After everything now, I'm 4 months past the surgery, and it's so much better that I'm just like I kind of say, why didn't I act on it? But we get so complacent, I think, in life that we just go on another day, go on another day, and then all of a sudden it's like,
All of a sudden it catch ups to you. So
yeah,
I saw a patient recently, actually last week, who couldn't pee. It was so bad that urine was backing up all the way up into his kidneys,
wow,
and he ended up in kidney failure.
wow,
So after draining his bladder, his kidney function improved. That almost killed him.
oh
Yeah,
yeah,
so it's not, even though we kind of joke about, oh yeah, you couldn't pee, but it is sometimes
yeah,
life threatening.
yeah.
Okay, so you had heart surgery and you ended up not being able to pee. What happened then?
I had a catheter in for 6 weeks.
How was that?
Awful. I mean, at least I could go. That was just a relief in itself. But you can't go on like that. That's just unacceptable. But so after the operation to, you know, clear up my prostate, there's night and day difference. You know.
So wearing a catheter, for those people who don't understand what a catheter is, can you explain how that made you feel and what that was?
Yeah, you got a tube that goes into your penis, and basically, sometimes you get a bag too that collects it. You know, but you have to have a bag, or you have that little cap that I had later on, which was much more you know
Much more convenient,
convenient.
yeah.
Yeah, it was convenient because you just pull the cap off and you just drain yourself. So that's way better than the bag. But either way, it's you got to deal with it when you're sleeping. You got this stuff on you, and it's just not you know it's not.
So you finally you couldn't pee, you had a catheter, and then how did you end up here?
Well, I wound up here because after the surgery, the heart surgery, I couldn't go, and I had you know catheter in for like three weeks or whatever, 2 3 weeks, and then I came here to see you and uh, scheduled the surgery, which I had to wait about 3 weeks for that at least.
Before we scheduled you for the prostate surgery, how did I evaluate you? Do you
Uh,
remember what we did? I have to look in.
yeah, you checked the prostate from you went through the penis, took a looked in there, went from the back. You looked at it. That was probably the most unpleasant part of the whole thing. The surgery, it's a surgery. You go in, you get knocked out, and it's you recover from there. But yeah, the diagnosing was not fun.
Well, that you're talking about cystoscopy, looking inside the bladder
Yeah,
with a small telescope. It can be a little uncomfortable,
yeah.
but how long was that procedure?
Oh, it's fast, man. You were like lightning. You know, it's just it was over real quick. So
So even though it is uncomfortable, it is not a long procedure.
no,
And
no.
were you able to see anything during the procedure?
I didn't really pay too much attention to it, so um, I can't comment on that too much.
That's okay. You had a prostate that was growing not just from the sides coming in to block your urine. That prostate was actually growing into the bladder. It was so
Oh,
big that it was growing into
yeah.
the bladder. And we ended up coming up with a solution, which is a TURP
Hmm.
surgery. Tell us about that procedure. You mentioned that you went through anesthesia for that procedure and you didn't really feel anything during the procedure.
Right.
What happened afterwards?
Well, you just you wake up and and you start to recover. You have a I had a catheter in for 1 day, and then the next day I came back to the office here. We got that out, and I was able to urinate on my own.
So you went from after your heart surgery for several weeks you couldn't void on your own
Right. Nothing.
to undergoing this surgery
Yeah.
TURP to open up your prostate, and then you wore a catheter for 1 day, less than 24 hours,
Right.
and then now you're able to go on your own.
Yeah. That's great. I'm able to just immediately drain. I don't have to sit there or stand there and just, wait and hopefully kind of co, coax it into going. But now it's just immediately, it's a real strong stream, and 20, 30 seconds, I'm done. It's just really nice.
Any changes to your sexual function, such as erection issues or anything like that?
No, just no ejaculation, you know. Which,
Well, you have orgasm, but there's nothing coming out. There's no semen
yeah,
coming out.
yeah, it's like blanks,
Yeah.
it's like,
Literally shooting blanks.
yeah,
Now, I jokingly say that generally, unless you're trying to get someone pregnant, or unless
right,
you are in the adult entertainment business, that
yeah,
doesn't usually matter to most
yeah,
guys.
yeah, unless your wife really likes that. So,
You know what? I have all people from all walks of life, and some guys it matters to them, and there are ways to perform that TURP procedure to preserve the ejaculation going out instead of having no ejaculation.
hmm. Well, the priority for me is just being able to urinate well. That's it. I'm 71 years old, so that's at that point, if I was my 20s or whatever, it'd be different, but yeah.
So, what we tell folks who are suffering with this urinary difficulty due to an enlarged prostate?
Would repeat, Pat?
What would you tell guys who are suffering with urinary difficulties due to an enlarged prostate?
Quit putting it off and just really just take care of it because the difference is night and day. And you know, uh, yeah, I can't even say how great it is to just go again. So yeah, I would just get it done.
Yeah.
It's not that bad. You go in, you get set up for the OR, and before you know it, you get wheeled in there, and you get knocked out, and that's it. You wake up, and then you do some minor recovery. I consider it very minor because what I went through with my heart surgery
Yeah.
was very, very intense. That was totally different. That was hard.
How has undergoing through TURP, that procedure for the prostate, how has that changed your quality of life?
Uh, well, it just totally opened up. Um,
Literally and figuratively.
exactly. It's just so nice to just be able to go for, let's say, when we go for a car ride, for an hour or two. I don't have to stop along the way all the time, and then when you stop, you go, you try to go, and it's just, oh, not much comes out, and you get back in the car and you start driving, and 2 minutes later you feel like you have to go again. It's just, oh, it's so aggravating. So this is just like freedom. It's like it should be. You know.
Well, thank you so much for sharing your story, Terry.
Sure, sure. I was glad to. I mean, I can suggest that, yeah, and as far as you are concerned as a doctor, I am totally pleased. And I
You're
would
too
give you a
kind.
5-star
You're
rating. I
too
mean,
kind.
seriously. I
You're
mean,
too kind.
yeah, you did a great job for me and I appreciate it. So,
Well, thanks, Terry.
okay.